Welcome to the session. It is 12 o'clock. We are going to get started. Um, Today's session is titled Quit for Good, Evidence-Based Resources for Cessation. This is the sixth and final session of our Project Echo series focused on youth vaping prevention, where we gain insights into best practices and share our collective experiences. I'm Sarah Kondrak, and I have the pleasure of hosting the first Project Echo Hub dedicated solely to supporting the behavioral health prevention workforce. There are 1,400 hubs across more than 200 countries, and we're really proud to bring the innovative model to Ohio as a resource for our prevention folks. So this Echo Hub is facilitated by the Ohio Center of Excellence for Behavioral Health Prevention and Promotion. You can visit the website listed on this slide to learn more about the center's work. The center is funded by the Ohio Department of Mental Health and Addiction Services and administered by Ohio University's Voinovich School of Leadership and Public Service in partnership with the Pacific Institute for Research and Evaluation, or PIRE. So many of you have attended our Project Echo sessions in the past, but if this is your first time, welcome. We're happy to have you here. The heart of Project Echo is the philosophy of all teach, all learn. Each session starts with a presentation from an expert on a topic, followed by a community member sharing their work and experiences. The reason Echo is so unique and effective is that everyone here brings their own knowledge and experience, and we'll have an opportunity to learn from one another during the discussion portion of the session. Some of the key benefits of Project Echo are that it quickly democratizes access to information and expertise. That means no matter where your location is or what your professional network is, you will have access to the latest best practices. Echo builds workforce capacity by empowering professionals across different sectors with the skills and knowledge they need to make an impact in their own communities. So some tips for today, please mute your microphone when you're not speaking. It is lunchtime, it's the noon hour on the East Coast, but if you could turn on your cameras, we would be so happy to connect with you. This session is really meant to build connection and relationship with your colleagues. Encourage you to use the chat feature throughout the session, particularly if you have resources relevant to the conversation that you would like to share. We will capture all of those resources and add them to a document after the session and upload that into iEcho for you to reference. Finally, if you have any tech questions or issues, please contact Nancy Clough, and she is happy to help you. Her email is in the chat. All right, we have an incredible hub team responsible for ensuring that this series meets your needs. You can identify the hub members by the white background and Echo logo. We're committed to creating an inclusive environment and providing all necessary accommodations. We'll start and end on time. And the only recorded part of this session that will be posted will be the didactic presentation. And this is out of respect for your privacy and the community members that you serve. We also ask our participants to help create a safe space and a respectful learning environment by valuing the opinions of your colleagues, using inclusive language, and protecting the privacy of everyone involved by keeping discussions confidential. Please share your experiences. We encourage this, knowing that this is a supportive space. So I have some good news to share with you all. In order to participate in these Echo sessions, you all had to create an iEcho profile in the iEcho platform. And you may have noticed that preventionist was not a profession when you looked in that drop-down menu. So you had to choose a title that most closely aligned with your job. And that's really because Echo was originally structured on a medical model. And in the past couple of decades, it's expanded into many other fields and now in prevention. And as I mentioned, we are the first behavioral health prevention hub. So it was our honor to advocate to add preventionist as a profession. That change happened last month, and we would love for our data to reflect all of the preventionists attending these sessions. So if you would like your title changed to preventionist, please put prevention in the chat and we will go in and do that for you. So you don't have to navigate changing your own profile if you want. us to do this for you, please put prevention in the chat and we're happy to do that. All right, and this month concludes both our youth vaping series and our adult low risk drinking series. We do have two other echoes that may be of interest that are currently running. And more information can be found on the Center of Excellence website. Again, we offer continuing education credits for all of our Project Echo sessions. And though this is our final youth vaping session, the Ohio Center of Excellence for Behavioral Health Prevention and Promotion continues to develop content for Ohio's prevention workforce. With guidance from the statewide Youth Vaping Advisory Committee, we are developing 5 asynchronous virtual learning modules that will be around youth vaping prevention, and it will explore many of the topics that we've already discussed in these sessions, and that will be offered to folks asynchronously. We're also excited to announce that the center will release a youth vaping prevention playbook in both printed and electronic formats. And this will provide guidance and best practices for youth vaping prevention. The best way to learn more about these resources is by staying tuned to the center's newsletter. And you can also follow us on social media for updates. And finally, I wanted to mention that the center is supporting a large media campaign in Ohio called Talk They Hear You, which was developed by SAMHSA. This is a national youth substance use prevention campaign, and not just alcohol, all substances. And it has a lot of great resources that might be helpful in your communities. You can find more on the center's website about those resources or SAMHSA's website by searching Talk They Hear You. All right, and with that, I would like to introduce you to our didactic presenter, Jessie Wingert. Jessie is a program coordinator at Summit County Public Health in Northeast Ohio. She earned her bachelor's degree in community health education from Malone University and master's of public health in health policy and management at Kent State University. Jessie is both a certified health education specialist and a certified tobacco treatment specialist. She has worked at Summit County Public Health for 21 years and has worked in tobacco prevention and control, reproductive health prevention, and with programming to reduce youth homelessness. Welcome, Jessie. We're happy you're here.
Helps if I unmute. So thank you. I appreciate being able to be here and have a little talk with everybody. So we'll get started. So the first, let me see if I can get this. There we go. So the objectives for today's session is to list the tenets of evidence-based tobacco cessation programs and identify evidence-based tobacco cessation programs that are available to youth when they are ready to quit. So we're going to go through a couple different things. But first, as we get started, if you've been part of these Echo series, you've seen all this data. We've brought it up a lot of times, but if you're new to this session or just kind of want a refresher, just kind of looking at what we are seeing for youth use. So the 2024 National Youth Tobacco Survey was completed, and that actually was able to show us where we're seeing what types of products youth are using. So any tobacco product, we had 8.1%. Which this is down from what it has been, but that's still a lot of youth that are using. We've also then for e-cigarettes, that is the most popular one. We see that at 5.9%. And really what that looks like is it's about 3.5% are middle schoolers and 7.8% are high schoolers. So we still have a lot of work to do. We still are seeing a lot of these youth using these products. So I want to talk about some of the products or some of those strategies and some other programs that are out there to help people quit, especially our youth. So when we look at youth and our tobacco, really the big thing with vaping is the nicotine. So nicotine is in any tobacco product. It is what causes the addiction. It does hit our brain within 10 seconds, so it's super fast. The problem is with our vaping is that our youth are using the disposable generation that they're using now is a really high level of nicotine. Like one Elf bar is equal to almost 30 packs of cigarettes. So it's a little crazy. And with the FDA not really regulating that nicotine level, we kind of don't really know what we're seeing all the time. So But what we know is that our youth, their brains are fully developed until they're about 25. So they can get addicted a lot quicker. And with these high level of nicotine, that's what we're seeing. So some other health effects, obviously the brain development. The nicotine, when it hits the brain, it's going to change the way the synapses are formed, the way your brain speaks to really the whole body. So we know that it causes the addiction, but then there's also some damage to our DNA and the way that our brain actually, like I said, kind of like functions. Because of that, we are seeing a lot of problems in schools with just youth like not being able to pay attention, falling asleep, maybe doing worse on their tests because they're constantly thinking about that nicotine. But then we're also seeing a lot of mood disorders. And we know that our youth are already stressed and have anxiety and depression, but it's really heightened by using that nicotine. I know the Truth Campaign, so I did share that on here. They have a lot of information really about how that acts within the body and really how that amplifies those symptoms. And then other effects, we know that it still is affecting our heart and our lungs, especially with our lungs because of the ingredients that are within that e-juice, the high level nicotine, but the flavors. The FDA has told us that we know that we can eat and drink flavors like they're allowed to be in our food and our drinks, but we should not be inhaling those, that they are damaging to our lungs. We know a lot of like the propylene glycol, the vegetable glycerin, things like that, we should not be inhaling. Within our e-cigarettes, we know there's also volatile organic compounds, the cancer-causing chemicals, heavy metals, all those things that we should not be breathing. So our youth, they're developing bodies, they're still growing. We're seeing, younger and younger youth using these products and getting their hands on them. So we want to try to do as much, obviously, to help them do some prevention work, but also for our cessation for those youth that do use. And finally, withdrawal. So quitting any kind of tobacco, there's going to be withdrawal symptoms. Everybody's different, but because of that high level of nicotine, we're seeing some strong withdrawal symptoms for our youth. So just kind of paying attention to some of those things that, especially within the youth that are in school, and what teachers or coaches and parents have to go through with when their youth are trying to quit. But the good news is that most youth do want to quit. A study that was done in 2021 showed that 65.3% of the youth were actually thinking about quitting. So that's good. They may have started it because of one reason or another, got quit or got hooked really quick, but now they're realizing, hey, this is probably not a good thing. Maybe because they're already starting to have some health effects from it, or they're just realizing, yeah, we know now what's in this and how bad it is for our bodies. And we know that 60.2% have already tried to quit, at least for a day. So that's really good news. We'll kind of hopefully we can keep this up and have more of our youth starting to quit. So some strategies. So we're going to talk about programming here in a second, but some other strategies that are out there. And what a lot of this was things that are happening here in Ohio, maybe even outside of Ohio. So if we do have some folks from outside of Ohio, you can look to see. Unfortunately, I don't know all of your laws, but there are a lot of policies that are done within cities and townships and villages, things like that. Our biggest policy change was Tobacco 21. So obviously this is throughout the entire United States. But that's where we raised the purchase age from 18 to 21. We know that 95% of our youth start before they're 21. So if we can try to keep that out of their hands, that's great. So it's really a lot of these policies are really about the accessibility and the availability of these products to our youth. Another policy is our retailer density. So trying to limit how many tobacco retailers there are within certain areas, maybe within parks or schools or just within a city limits themselves. So if we don't have as many out there, there's not as many opportunities for youth to purchase them or to see them within those retailers, like walking into the gas station or something like that. And then advertising. Advertising is huge with our tobacco companies. The tobacco companies spend $1 million an hour advertising their products. So if we're able to limit how much there is, that is really good because again, you see things, it's a constant reminder like, oh, hey, I wanted to try this. I mean, think about how many times do we even look at like different flavored pops or sodas? There's a lot, it's even for us as adults. So same thing with our tobacco. And then other tobacco-free locations. So making sure that there's tobacco-free outdoor parks. So maybe at concerts. So again, it's not, if the youth aren't able to see it or get their hands on it, it's better and hopefully that they won't be using the product, or if they are, they can't get more of it. Another thing, which this obviously is something that would have to be done more statewide, is raising the tax and also increase the overall price of the tobacco products. All those are just some strategies to help keep our youth from using tobacco or to get them to quit. Other strategies, flavor ban is a big one. So we don't have flavored cigarettes any longer other than menthol. But unfortunately, we do with our cigarillos and then especially with our vapes. That is obviously the big reason why a lot of youth use is because of those flavors. So being able to ban some of those flavor or ban those flavors will hopefully help to reduce the amount of youth using. Obviously, there's prevention programs. There's a ton of them out there in different things that can be done to educate our youth and even our adults about vaping. And then the Ask, Advise, Refer. So this model, the AAR, anybody really can get trained in it, but it's a really good program or really good asset for people to have to be able to, ask our youth, are they using, talk to them about quitting, but then referring them to some type of program. So we'll go over the programs here in a second, but that is a really good thing, even for adults, but for our youth, is still something that can be done by our parents, by teachers, coaches, and especially like our physicians if our youth are actually, going to the doctor and having those conversations. So evidence-based tobacco cessation. In general, the greatest success is going to be with a combination of behavioral counseling and medication. The behavioral counseling that can be done in a variety of ways. So a lot of the program I'm going to talk about are this type of counseling. So it's in person. You can do individual or group discussions with a certified tobacco treatment specialist, even with a physician, some other behavioral health counselors, people like that to really talk about quitting. Or there's virtual. There's a lot of phone like quit lines and like text apps, things like that you can do online. There's a variety of things out there. And then there are 7 FDA approved medications that can be used. However, those are to be used by adults. Unfortunately, if you're under 18, it is contraindicated. However, it's kind of up to a doctor too. He may or may not, or they, I'm sorry, may or may not say that the youth can use it. It kind of depends on their addiction and things like that. But in general, the greatest success is using a combination of those methods. All right, so I'm going to go through some cessation resources for youth. By no means is this an extensive list. There are so many programs out there. Really trying to look at some of those evidence-based. So I'm going to share ones that are here or that we have and it's been used here in Ohio. Some other states may have some other type of programming. And I do kind of want to caution and kind of preface, there are some other cessation resources out there that are from the tobacco company themselves. I would be hesitant just with those because you want to make sure there's not some type of underlying agenda there. But a lot of these programs, what I'm going to talk about, are going to be free programming. There is one or two that maybe that you would have to get trained as a facilitator, and that may cost some money. But overall, most of these are going to be some free resources. So I know this will be in the Echo it's already uploaded into the drive, so you have access to all of these slides. So a lot of things should be in there, but we'll go through some of these now. So the first program is Not on Tobacco. It is from the American Lung Association. This one is actually, you do have to get trained in it. It does cost about $400. There may be some scholarships to get trained in it, but this one especially is for youth. It is a cessation program to do a group format. I did participate in the training a few years ago. I just, however, have not been able to do actual group work with our youth with this. But it is a good program that is out there. It's been around for a number of years. It's evidence-based. It's been peer reviewed. So there's about 10, 50-minute sessions that you do with your youth. It's a really good program. So there's that. But then they also have a Not For Me. It is a mobile-friendly online program. This one is specifically for youth 14 to 19. Again, it's from the American Lung Association. and there's about 8 self-paced sessions. So they suggest that you view them weekly. There's some other programming that's involved with it. There's other tools and tips, but it is definitely it's an online type of program, but it can be done through your phone. And I believe this one is free as well. Some other ones we have that are national. So the teensmokefree.gov. So it's excuse me, I apologize. This website has a lot of information, a lot of articles about quitting. There's a place where you can actually create your own quit plan. Offers a lot of tools and tips, things like that. There's also some other ones that are not just for teens. So if you're looking for like adults or older adults, and there's some other specific target populations, that's also within that website. You can get to some of those other ones too. But then one of the things too that they offer is the Quit Start app. So I did provide a screenshot of what that looks like if you go to your Apple Store, uh, the one I have an Apple, so that's what I go to. So your wherever you get your apps, but that is a free app that you can actually do as well, and that you will also when you sign up for it will create a plan of helping you quit. So youth are able to use that because we know our youth are using a lot of more technology, more our phones. It's doing things more, excuse me, on our phones versus maybe calling. There's also then smoke-free text for teens. So this is again mobile friendly. It's daily text to support youth in quitting. This one is for 13 to 17-year-olds, and they can text quit to 47848. This program is from the National Cancer Institute program. Again, it's free, so it's another mobile-friendly version of a cessation program for our youth. This is Quitting is another one. So this is a free program from the Truth Campaign. And like I said, the Truth Campaign they have a lot of information. There's a lot of different things that they talk about, but tobacco has been the main thing they talk about. There is information about even vaping, marijuana. I know we had a session a couple months ago about cannabis. So there's some information there as well. But it is anonymous, it's confidential. You have to be at least 14 to use the program, but you can text ditch vape to 88709, or even just click the join on the truth.com's website. So there's a couple different ways that they can get enrolled there. They set up that it's really personalized to the youth as well. So there's depending on how many sessions that they want to do. So there's not a specific set of sessions for that program. Then there is the Ohio Tobacco Quit Line. So here in Ohio, and I know that some other states have this as well, the 1-800-QUIT now, it is free. We just actually switched over to a new vendor, so there's a lot more information that's going to be that you can use for this. So it is for phone. There's a text-based feature that you can do web enrollment. They actually have it set up that you have a dashboard now that can track your use. So youth can do this. There's other special programs for pregnant women, for behavioral health, things like that. If you're 18 and over, you may be eligible for nicotine replacement therapy, so like the patch gum or lozenge. But youth can also use this program as well. And I think that's like a 14 to 17-year-old for that. The other program we have here in Ohio is Live Vape Free. So this is a brand new program. We used to have the My Life, My Quit program, which some other states may have. But here in Ohio, we just switched over. We are now using this program. So the livevapefree.com is the website. It is free for our young adults, 13 to 26. So this is actually a little bit older too. So this is specifically to help our youth quit vaping. It is a text-based program. So it's actually like an AI generated. So when the youth or young adult goes in and enrolls in the program, they actually answer a bunch of questions, and the tools and everything that's when they are talking to the youth is really specifically to them. So if they're worried about, their athletics or their sports, and their vaping, they're going to get more specialized information about that. They also can actually talk to a quick coach live, so they can actually do a chat feature with them with that as well. So there's about 9 to 11 sessions. It is what they typically go through. But again, it's very customized to that youth. So I do have on here to enroll the quit line. That is wrong. It's just that livevapefree.com. So I forgot to update that. But that is one of our new programs here, and it is confidential. So the youth do not need to have parent permission in order to be in the program, which is kind of nice. So if we have our youth that, they want to quit, but they don't want to tell their parents that they're doing it or have to go through that whole, that permission, they don't have to. So it's kind of nice that they're able to do that. And then even the fact that we've included up to 26 now, because we know that even like our college age kids are vaping as well. So that is again our program that we have here in Ohio. And then there's other local resources. So you can always check with your local hospital systems, your health departments, behavioral health settings. They may have some other programming that is out there that they may be doing on their own. And then there are support groups. I know here in Summit County and we have a really, really active Nicotine Anonymous group. So while it's not necessarily a cessation resource, it is a support group. So if a youth wants to stop vaping, they can actually go there too and even talk to them. I know we have a lot of virtual sessions here in Ohio or in Akron, but you can always check into that. So that's kind of a quick down and dirty of some of the resources that are out there. Again, there's a lot more they can find that may cost some money, but I try to kind of focus on a lot of those that we have here that are free, that are very easy to use as well. So that's all I'm going to share with you guys for now. So I appreciate it. Thank you so much. And I'll move on and stop sharing here.